Cervical Intraepithelial Neoplasia, or CIN, refers to precancerous changes in the cells on the surface of the cervix. It is not cancer, but if left undetected or untreated, it can progress to cervical cancer. The primary cause of CIN is a persistent infection with high-risk types of human papillomavirus, or HPV, especially types 16 and 18. Other contributing factors include early onset of sexual activity, multiple sexual partners, a weakened immune system such as an HIV infection or from immunosuppressive therapy, smoking, long-term use of oral contraceptives, and co-infection with other sexually transmitted infections, such as chlamydia. Cervical intraepithelial neoplasia is usually asymptomatic, especially in its early stages. However, if symptoms do occur, or if the condition progresses, they may include abnormal vaginal bleeding, such as bleeding after intercourse, between periods, or after menopause, unusual vaginal discharge, and pain during intercourse, typically seen in advanced cases or associated conditions. Because CIN often shows no symptoms, regular screening is crucial for early detection. CIN is typically diagnosed through routine cervical cancer screening and follow-up tests. These may include a Pap test to detect abnormal cells on the cervix, visual inspection with acetic acid, or VIA, where immature cells in the transformation zone turn white, visual inspection with Lugol's iodine, also known as the Schiller test, where immature cells do not take up the iodine stain, HPV DNA testing to identify high-risk HPV types, colposcopy, a magnified examination of the cervix using a special microscope. This may include a biopsy of abnormal areas, and finally, a cervical biopsy, which confirms the diagnosis and determines the CIN grade. CIN is categorized into 3 grades. CIN1, or mild dysplasia. Changes affect the lower third of the cervical lining. CIN2, or moderate dysplasia. Changes involve up to 2/3 of the lining. CIN3, which includes severe dysplasia and carcinoma in situ. Changes affect more than 2/3, possibly the full thickness, of the epithelium. In cytologic evaluations, the Bethesda system may report atypical squamous cells, including atypical squamous cells of undetermined significance and atypical squamous cells in which high-grade lesion cannot be excluded. Low-grade squamous intraepithelial lesion, typically consistent with CIN1. High-grade squamous intraepithelial lesion, or representing cytologic changes that correspond to CIN2 and CIN3. Treatment depends on the CIN grade, the patient's age, fertility desires, and overall health. For CIN1, many cases resolve on their own, especially those caused by transient HPV infections. Management often includes observation, with repeat Pap smear or HPV testing every 6 to 12 months. For CIN2 and CIN3, active treatment is usually required to prevent progression to cervical cancer. Common treatment options include cryotherapy, that involves freezing abnormal cells, loop electrosurgical excision procedure, which removes the affected tissue, cold knife conization that involves surgically removing a cone-shaped section of the cervix, and laser ablation using laser energy to destroy abnormal tissue. After treatment, regular follow-up is essential to check for recurrence. If untreated, particularly in CIN2 or CIN3, the condition can lead to invasive cervical cancer over time. Other complications may include recurrence after treatment, cervical stenosis or narrowing of the cervix, which may occur after surgery, a higher risk of preterm birth or miscarriage in future pregnancies, especially following excisional procedures, and emotional distress or anxiety due to a diagnosis of a precancerous condition. Steps to reduce the risk of CIN include HPV vaccination, ideally between the ages of 9 and 12, routine cervical screening through Pap smears and HPV testing, safe sexual practices such as condom use and limiting the number of sexual partners, quitting smoking, and managing any conditions that suppress the immune system. If you found this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.